Welcome to Coffee and Conversation. I'm Chuck Adams, and today we'll be discussing a topic that I know is at the top of everyone's mind: reopening your practice post-COVID-19. I'm really excited to introduce our guests today, Alan Wink, COO, and Dr. John Albertini, Chief Medical Officer with Qualderm Partners. Alan, Dr. Albertini, welcome to the program.
Thanks for having us, Chuck.
Yeah, thanks. It's good to be here.
Awesome. A little bit about Qualderm Partners. You guys really help dermatologists practice position their practices for sustainable growth and profitability. And you've created an affiliate partnership model that provides practice management support really in critical business areas like operations, finance, information technology, and human resources. And with 44 practice locations across 7 states, we felt like you could provide really a unique perspective on the steps that you're undertaking to safely and effectively reopen your practice network. So let's just dive right in. Let's start with the decision to reopen. Really, why has your group decided to start seeing patients again now?
Sure. Chuck, I'll start, and Dr. Albertini will like to fill anything in. That'd be great. So really, we've been carefully monitoring the COVID-19 situation ever since it started. When it first hit us pretty heavily, we didn't have time to plan adequately, and we just had to react, like many across the nation had to do. So now we're in this situation where we're beginning to reopen. We're monitoring both the state and local and federal guidelines, also utilizing a lot of our specialty members and boards that are around that can help give us guidance. And so with the 14-day reduction in cases is the main gating issue for the CDC. Many of our markets have already qualified for that or are close to qualifying in that gating issue. So we just, we're not trying to make one decision fits all, but we're trying to be very thoughtful in monitoring everything that is out there for us to look at.
Gotcha. Yeah, there's certainly a lot of guidance happening at the federal, the state, the local level, including all of the different medical boards that are really trying to drive the reopening within our space. Let me ask this. Okay.
And Chuck, one thing I'd be remiss if I didn't say, the other big piece that we're relying on is just those key physician leaders in each of our sites. We're taking their thoughts and what they feel is important and what we could do safely for our patients and our staff before we start opening that. So, I left that part out, but that obviously is one of the biggest issue as well, is once we hit the gating criteria, we need to make sure that our physician partners feel like we can open safely for the patients and all the staff members.
Gotcha. No, that makes total sense. So you bring up safety of staff and certainly patients. What are the steps you guys are taking at the practice level to really drive that safety across patients and staff?
Yeah. So. It's a multi-tier for what we have to do to keep that done, but we're trying to be very proactive as an organization. We've prioritized the employee and patient communications. There's no perfect communication during a time like this. You can never over-communicate in a time like this, but we try to provide as many touch points as possible. We're really lucky that Dr. Albertini puts out something on a weekly basis for all our providers. Bill Southwick helps lead the charge, who is our CEO, in communicating with us, with our employees. And we continue to figure out how we can communicate with our employees the best. Unfortunately, email is the easiest way for us to get a message out. But we've also got, through our company, our payroll system called Paylocity. They have a portal in there called the community portal. It's similar to a Facebook, so it also allows us to communicate that way. It also is good because even like many companies, we've had to have furloughs. and we still can communicate with our furloughed employees by utilizing that platform. So there's no perfect communication, but what we feel the most important thing we do is to communicate often and be clear. And if we have a change in what we communicated, admit it and come back out and send a new message. So it's because of all the leadership throughout the group, from, like I said, from Bill down to Dr. Albertini, myself, Mike Serino, our CFO, Jody Waite, the head of our HR. We're all very much involved in what we need to do to keep our communications going to our employees, our patients, and our providers.
Yeah, so it sounds like regular communication is certainly key. What about feedback from the employee level? Are y'all doing anything to really foster that type of feedback?
Well, I would say, as Alan alluded to, as Chief Medical Officer, I've been very involved also with the communications and trying to have frequent touches with all the staff and try to include fact-based scientific articles, reviewing of press releases, review of official administration, CDC, FDA, all the state and regulations, and try to provide some statistics and some clarity around what's happening with the COVID curve. There's a lot of confusion and a lot of anxiety, and so communication is really critically important there. As far as feedback, we very early initiated a separate email account called health@qualderm.com, which has been really critical in ascertaining what those fears are out there. So if people want to respond directly to that, we have a conduit for that, and they can also just respond. I've had many messages personally about different concerns, and that has allowed us to respond to staff's questions, fears, and also to solicit ideas and suggestions. So we've been able to develop and refine our really Qualderm best practices because we've had so much input. I guess I'd also say that, as Alan indicated, we've been really focused on supporting our staff through their anxiety. We know there's a lot of depression, anxiety, mental health issues during these times, and we're trying to work to reassure our patients and their families about what's going on and provide an evidence-based dialogue with them. The other thing that I've found that's come out of this crisis, which has been very positive, is that because the healthcare community is coming together, we've been able to leverage each other's experience and knowledge. And I've become a bit of an infectious disease and public health expert over the last couple months, but I have broad relationships across the industry, across dermatology, that I've been able to utilize, and everyone is sharing, really trying to do what's best for the patient. So that's been really gratifying.
What about developing, and I would imagine this is something that's been certainly discussed across your organization, but what about different safety protocols to prepare for when you reopen? Maybe some things that you've done at the practice level. I do know, I believe from our earlier conversation, that you guys were early on actually suspending cosmetic services even before the guidance came out. So can you talk a little bit about maybe those two things?
So, so as we reopen on the safety-wise, when patients come in, they're going to see all our staff members wearing the proper PPE, personal protective equipment. And that's really important, and it starts at the front desk. So even the front desk people that are registering folks are going to have on face masks, going to have on eye goggles. We're going to ask the screening questions. We're also for certain cases and patients in locations, you may even have temperature screens. And if we have a patient that either has symptoms or ends up having a fever when they come in, we'll reschedule those patients. We're asking the same thing of our staff members. Don't come in if you've been sick or if you've been around folks and potentially been exposed to COVID-19 right now. Throughout this, we're also asking our patients, and we're utilizing different tools, either through text messages, demand messaging, through our email system, and even on our websites. So it's on our websites. We've actually created a banner letting folks know we're reopened, but through there's an FAQ that they can click on, kind of highlighting some key things for us. And part of that is we're asking our patients to wear a mask or wear a cloth mask when they come in. They have visitors, have those on, because we're trying to do our part to maintain the social distancing, but also provide those masks and being safe when we can. We're out in public. We're also doing other things. We're limiting the shared items. So what I mean by that, the iPads aren't being touched anymore. They're being maintained by the MAs or the nurses in the rooms. Doing verbal consents, being thoughtful in pens, paper, magazines. If not leaving magazines out. If somebody brings one in, we're asking them to make sure they take it back with them. So it's a different world right now. And, virtual waiting rooms, utilizing their cars to wait. So it's just a whole nother world. There's some things that I think makes a lot of sense from a patient engagement that, that maybe we could have been doing better before this, that, it's going to cause us to do better now. And we're just, such as, how we communicate more often with our patients, letting them know what's going on. There's certain things we take for granted that, there's nothing like a pandemic that causes us to realize some things we can do better. But overall, just everything that you hear on the news and out in the world, that's what we're trying to do for our patients and our staff.
I'll follow up on that now, is that, early on, we were very proactive in implementing safety and quality protocols and using the best evidence available. We suspended elective care very early, even before some of the literature came out recommending that. We discouraged staff and providers from attending dermatology conferences, which were ultimately then canceled, but we had already proactively advised against that. So we really tried to take patient and staff safety as our top priority. And really that was possible because of what we have at Qualderm, which is a physician-led quality council. And that's comprised of lead physicians from each of our markets with expertise and authority to recommend guidelines for our practices. And so we very early on used inputs from federal, state, and local orders, from our specialty societies, from academic institutions, and from evidence-based literature to develop our triage categories of care so we could determine which patients were urgent and needed to be seen throughout the crisis, who was semi-urgent and could potentially be delayed, and who was more elective that could be either rescheduled or provided a telemedicine visit, which I'll talk about in a second as well. But the final approval always rested with that individual physician's judgment on what was the necessary care. So we're not creating strict guidelines that were, they couldn't be overridden. Physicians ultimately have the responsibility and the judgment to take the best care of their patients, and that was what we relied on. But those guidelines were very helpful in letting us keep patients and staff safe.
Yeah,
and then
absolutely.
To move on, regarding telemedicine, I would say that's been really a critical part of our response to this crisis. We'd had a very limited amount of video virtual visits before this, but we've been able to expand our service lines tremendously using teledermatology and video visits with our patients in ways that we hadn't really anticipated. So, acne and psoriasis and eczema follow-ups, wound care follow-ups are very amenable to these types of visits, and have been able to keep especially the vulnerable patients out of the clinics and at home where they're the safest. It's also reduced the need for staff to be in the office and have kept them safe as well. And we're refining that. So we anticipate post-COVID that we'll really be able to have another service line and more opportunities for patients to engage with us using telemedicine and video visits. We've developed a task force of operational folks and information technology, the EMR, as well as physicians and providers to really leverage that and optimize it for the future. So we see that as another positive coming from this crisis.
Yeah, absolutely. And just to follow up a little bit on what Dr. Albertini said, because I don't think he gives enough credit to his leadership to this with having a chief medical officer and the quality council, because without those folks alongside of us as typical operators, it's a much different sell. But having a physician led organization that is hand in hand with our providers and letting them know that we trust them, that the patients they need to see, that they can see, and we can do it safely. And really just have an open communication of why we're doing things, where our guidance is coming from, why, and ultimately, it's driven by safety for our patients and our staff. But having those physicians side by side with us really helped us get through this crisis as best as possible.
Yeah, no, I think having that that collaborative approach is certainly going to be a differentiator. So it sounds like if I'm a patient and I'm coming into one of the practices, I should feel confident knowing that everybody's wearing the appropriate PPE. There are steps being taken to really ensure that there are protocols and practices in place to ensure that there's a healthy and safe environment, and I should feel comfortable coming in. Let me ask this: what plans do you have in place, or how are you going to go about trying to maintain social distancing standards once folks are in the practice?
Yeah, that's a great question and really relevant in this day and age. And so we've done a number of things. We've limited our provider schedule. So dermatology typically is a high volume specialty, lots of visits, but often of shorter duration. And so we've adjusted schedules so that there's more time between visits to allow for staff and patient flow throughout the clinic, literally, walking through and determining where people are going to walk, where they're going to flow in and out of the clinic, where they would need to be waiting, and to allow that 6 to 10 foot spacing. We want to reduce any congestion at check-in and check-out. We're using tape like you see in all the grocery stores and shopping sites to ensure people maintain their social distancing. We've removed furniture or rearranged furniture so that people aren't sitting close to each other, and reconfigured workstations throughout the clinic so that even our staff are not congregated together. We're staggering work shifts, staggering breaks, encouraging lunch in your car as opposed to in your break room. All those measures to just reduce the interaction of patients and reduce the risks of transmission throughout our clinics.
Yeah, and we're requesting patients limit their visitors, or if they have visitors with them, for those visitors to wait in the car. If they need to help them into the office, obviously, and then wait in the car to be safe. The other piece on the reopening that to maintain that social distancing, I'll tell you that, you mentioned that we have 44 sites in 7 states, and we don't think it's a cookie cutter because we have them from our square footage ranges from a few hundred to, a few thousand. So not everything is built the same, and it depends on the type of providers that we have in that space. So we're being very, very thoughtful by state, by location in our reopening plans. One, to make sure that patients feel safe coming in and that our volume can maintain. We don't need people just sitting around hoping the patients come in. So we're trying to be thoughtful in that piece. And then secondly, making sure, hey, we may have the patients, but can we really take care of that volume? As Dr. Albertini discussed, can we really take care of that safely from a social distancing standpoint? So it is not one size fits all. We're trying to be thoughtful because until we hit the next phases, some other pieces and things change. We can't have all the staff in the break rooms at the same time. You know, that's not fair to our patients, not fair to our staff or our providers. So very thoughtful, very deliberate by site of how our reopening is going.
Yeah, I would echo that. And, you know, for example, some of our practices are more surgically oriented. So for those patients that are having Mohs surgery, you know, those patients are scheduled in waves where they will come in and have one nurse with one room and their surgeon, so they're not recirculating back out into the waiting area, and they can have more intensive, you know, almost a private room experience, so that there's not that risk of circulating through the clinic. You know, we're doing the same thing with medical derm as much as possible, keeping people directly from the car, from the front desk right through the exam and then back out. And as Alan said, you know, we're screening patients, staff, including delivery personnel. Anyone entering the facility is screened with questions, temperature checks on all staff members and patients. And, you know, we're following all the CDC guidelines as far as sanitation and housekeeping, cleanliness. So I do feel confident that our clinics, while they aren't, as Alan said, we can't say one size fits all for how we manage the flow and how we're managing the reopening process. We have a very extensive checklist of protocols that we're all following to ensure safety for everybody.
Yeah, I mean, it sounds like y'all have really thought through all of the details that are going to be necessary, regardless of practice size, to provide a safe environment where you can provide the quality care and still maintain some operational efficiency and how that actually happens. Last or finally, what are some things that you're doing at the practice level, really from a cleaning and sanitization standpoint, just making sure that that patients can feel comfortable coming into the practices?
Yeah, first off, we're obviously following the cleaning protocols that the CDC put out there around the COVID-19. Making hand sanitizer available, paper tissues, trash cans readily available within those common spaces. But extra wipe downs, especially in the high touch areas. So the waiting rooms, wiping down after patients leave a chair and the adjacent chair. Just making sure that we touch those high use items a little more often than maybe we used to. And then obviously all rooms are clean after each patient leaves, and so they're cleaned multiple times throughout the day. But really it's, the places that you hadn't thought of before around the waiting rooms that may have got cleaned up in the day. Those are getting touched multiple times now throughout the day. Check in, check out, where there are people resting their hands and doing things, making sure those areas are wiped down multiple times a day. So really just, starts with what the guidelines are from the CDC, but looking at those high touch areas and being more deliberate about wiping those areas down, sanitizing those areas, and helping, making sure the patient that's coming next feels good about where they're about to sit down or touch.
Well, I tell you, it's certainly a big challenge, but it sounds like you really thought through all of the different steps that are going to be required. And yeah, I think the big thing is really establishing confidence that patients can go out and feel safe and healthy. And it sounds like y'all are doing all the right things. And I really appreciate the time today, and I know that this is something that's on everybody's mind. So I know it's going to be really topical. Thank y'all so much for the discussion today.
Chuck, thanks for hosting us, and thanks to Bell Media for putting these on. I think this is going to be a really good educational series that y'all are doing. So thank you.
Yeah, I agree. Thanks, Chuck. It's our pleasure to help demonstrate what we've been doing and why we feel patients will be well served in our practices. So thanks.